When a patient falls in the shower, it's important to stay calm and handle the situation the same as any other fall in a healthcare facility. Turn off the water and dry the patient as best you can. It's impossible to pick up a wet, naked, slippery patient off the floor safely. Using towels, bath blankets, or extra linen from the patient's bed, keep the patient dry and warm until help arrives. If the patient has fallen in a shower stall with an elevated lip or step up, pad the step using pillows and blankets from the patient's bed. The pillows and blankets will provide a sort of cotton speed bump to ease the patient out of the shower stall. The padding should be securely tucked in place and partially under the patient. Once the step is thoroughly padded, place a single slide sheet under the seated patient from head to toe. Ensure the sheet is directly under the patient. Once in place, tuck a second slide sheet under the first between the linen or hard surface. This will allow caregivers to rotate the patient on the two slide sheets and slide the patient out of the shower. Once the slide sheets are in place, a full-body repositioning sling is laid on the floor near the shower stall. Ensure the sling is facing the correct direction and right side up. Depending on the patient's position in the shower, she may slide out feet or face first. Always ensure the patient's head is protected. It may be necessary to use a pillow. Slide the patient out of the shower, over the padded step, and onto the repositioning sling. It may be necessary to use a third slide sheet to transfer the patient to the head of the sling. If the patient is able, instruct her to help by pushing with her feet and legs. Once on the sling, remove the slide sheets. Never lift a patient with the slide sheets in place. With the patient on a full-body repositioning sling from head to toe, the lifting straps on the sling are used to slide the patient out of the restroom to allow space for the portable lift. While the lift is brought into position, pull the sling up under the patient's bent knees and hold in place using the lifting straps. The lift is brought to the patient's side. The lift legs are open to the widest position. Placed first under the patient's bent legs and then around the patient's head. Caregivers ensure the lift legs do not make direct contact with any part of the patient. The carry bar should be directly over the patient's midsection. Once in place, the lifting straps are attached to the hooks on the carry bar. Caregivers should communicate to ensure the same color loop or ladder is attached to the carry bar as they work down the sling from head to toe. As the lifting straps are attached, caregivers will ensure they are each secure before moving on to the next. MedCo technology repositioning slings are designed to cross between the patient's legs to ensure the patient is completely secure during the lift. Slowly lift the patient off the floor. As the patient is lifted, check the straps to ensure they are securely placed. The patient is supported by 2 caregivers during the entire lift and transfer. Once raised to the height of the receiving surface, the patient is moved to a bed pre-loaded with slide sheets. The slide sheets allow for simple repositioning and skin checks post-fall. Once lowered to the bed, the sling straps are removed from the lift and the lift is moved away from the bedside. The sling is straightened under the patient to prevent any wrinkles or potential pressure areas. The slide sheets are also removed before the caregivers leave the bedside.